Hello, welcome to the December live stream for the Inland Coalition on Aging. Today we're going to discuss behavioral health and social supports. Behavioral health broadly refers to a person's mental, emotional, and social well-being, as well as behaviors and actions that can impact that well-being. Access to senior or community centers and libraries, availability of social support and interaction opportunities, bereavement groups, and ease of access to mental health care are all important for behavioral health and impact it. Initially, when we spoke with community members in San Bernardino and Riverside counties for our Inland Empire Master Plan for Aging Needs Assessment, we asked questions about depression. However, people didn't want to speak about being unhappy and negative emotions. They wanted to talk about the spectrum of emotions that they experienced, the people and the actions that shaped those emotions, as well as how their personal and social life impacted their mental health. And when people did speak about depression, they acknowledged their stigma with such feelings. So today we're here to talk to you about the importance of behavioral health and social support for those who are aging and experiencing disability in the Inland Empire. And so I'm going to introduce to you our guests and myself. I'm Elizabeth Bogmill. I've been a consultant for the Master Plan for Aging for the last 2.5 years. As part of that role, I conducted the needs assessment and helped facilitate working group discussions, and I'm supporting the forthcoming IE Master Plan for Aging. We have with us today Tony Ortego and Dr. Karen Sadie-Water. Can you each share with us a little about yourselves and your involvement with the IE-MPA? And we can begin with Tony.
Yes, thank you, Elizabeth. So again, my name is Tony Ortego, and I am an administrator for Riverside University Health Systems Behavioral Health. I oversee our older adult program known as Wellness and Recovery for Mature Adults, which consists of about 8 locations for geriatric psychiatry and other services throughout Riverside County. So I was very honored and pleased to be part of the Inland Empire Master Plan on Aging, working very closely with my counterpart, Dr. Sadie-Water, over in San Bernardino County. Both of us represent the Inland Empire, which is a large population of about 4 million people covering between 2 counties geographically, making up almost half of Southern California. So it's an honor to be working with the Inland Empire Master Plan on Aging over the past 1.5 years. We've created some great work, and we recognize some milestones. And I'm hoping that we can finalize and move forward into action in 2025.
I agree.
And Dr.
My name is Dr. Karen Sadie-Water. I'm the mental health program manager for AgeWise in the Office of Public Guardian with San Bernardino County. I joined the correlation. It was voluntold, but however, it has been a blessing. I have expanded my knowledge of not only what the correlation does, but also how they're making this master plan. I believe it's very proactive in attempting to connect people to services and also bring awareness to the different stages or the different modules in the plan. It has been an honor being at the meetings, to be in the meetings and see everyone's passion. And we have members who not only work in this capacity professionally, but they also are part of the population as well. So to hear their insight on what they go through every day living in this space has been invaluable. And then I take that knowledge back and help AgeWise grow from that knowledge.
Thank you so much for both being here and for participating in our discussion today. We're so happy that you've participated as co-chairs for the Behavioral Health and Social Support Working Group and are continuing forward to help support the master plan. So Karen, can you tell us about why behavioral health and social supports are important for the Inland Empire?
Yes. So one of the, sorry, take a deep breath. Some of the importance of social support is, as we know, isolation can be detrimental to someone's mental health, but also can turn into somatic symptoms as well. And so when we isolate, that tends to negatively impact us. And so when we have programs like this, our programs within like San Bernardino County, we have a nutrition program that seniors and people with living with disabilities are able to come, and we not only feed them, but we increase that social support. They have gardening, they have live bands, they have arts and crafts, bingos, dancing. They get a healthy meal. Then we have senior fairs where throughout the county, um, other organizations are able to come and have a table. And so now they are now connected to resources outside of just coming and meeting with their friends who they've created there. One of the initiatives that grew from there was we had an access to technology grant that gave out 2,500 devices, iPads, iPhones, and hotspots. We were able to use those nutrition sites to give out devices to those individuals. And now they're able to do telemedicine, telehealth. They're able to play games. They're able to Zoom call with their family and friends and just divide that as well. That socialization is just extremely important.
Thank you so much, Karen. Tony, would you explain to us a little about behavioral health and social supports and what they all entail?
Sure, I'd be glad to. So thank you, Dr. Sadewater. Behavioral health and social support, I believe, go hand in hand. It should be a marriage. In my opinion, anyone providing older adult services or services to adults with disabilities should incorporate social support systems into the behavioral health services that's being offered to our seniors and individuals with adults with disabilities. I'm here at the Wellness and Recovery Clinic for mature adults, part of Riverside University Health System's behavioral health program that serves older adults ages 60 and above. We're driven to focus on helping the individual achieve their optimal level of community functioning. And I think community is underscored because it really takes a village, right? It's not just coming into a location or a clinic and getting a treatment and moving on for the day. Developing the social supports, creating group therapies, creating other means to connect individuals with the community is what it's all about. So the treatment on the clinical side is extremely important, but the connections that we're making for our older adults in order for them to, again, have that optimal level of community functioning and personal and social health is imperative. The older adult systems here in Riverside County, again, we aim at providing services to those with severe mental illnesses ages 60 and above. Our services really focus on wellness and recovery and resiliency. We do provide assessments and treatment and treatment focus for consumers' recovery goals. The consumers actually play a large role in identifying their recovery goals. We provide medication, housing services if necessary. We evaluate placement needs, and we consult with primary care physicians and link them to other healthcare professionals, including peer and family support services in our program, as well as throughout the community. And thank you for bringing up the locations. As you can see, our Wellness and Recovery Program for mature adults operates out of 8 primary locations. We also provide services in Blythe, which is on the border of California on the eastern side. So we have our great information up here. For those individuals who are watching this cast, please feel free to take advantage or share this information.
Thank you so much, both Karen and Tony, for sharing about some of the resources that already exist. And as we've been going through this process, we're finding out that a lot of the resources that people in our focus groups, which I'll talk about in a second, we're discussing they had a need for already exist, and there just needs to be a lot more awareness about what's available and how to access these resources. So now I'm going to review some of the key findings surrounding the behavioral health and social support from our Inland Empire Master Plan for Aging Needs Assessment. And we can also discuss how we arrived at these recommendations that we're going to be integrating into the Master Plan for Aging. And we'll hear a little about those recommendations and objectives from Tony and Karen after. So as part of our preliminary planning for the IE-MPA, or the Inland Empire Master Plan for Aging, we conducted a needs assessment We held focus groups with diverse groups of people, individuals who are English speakers and Spanish speakers, caregivers, LGBTQIA individuals, African Americans, Hispanic and Latinx, veterans, unhoused individuals, and low-income individuals in rural areas, and those who were disabled as well. And then we were also able to procure a existing survey of the experiences of tribal elders in the local communities because it was important to get representative voices within the community to represent and hear about their experiences with behavioral health and social supports. So in these focus groups, we spoke about people's experiences with all different ranges of topics, ranging from housing and healthcare to behavioral health and social support, to Alzheimer's and other dementias, and caregiving as well. So I'm going to review 5 key findings focusing on behavioral health and social support to contextualize how community members' experiences are shaping this master plan for aging. So the first theme is that many older adults are experiencing unwanted isolation and loneliness, and this is often due to mobility or transportation issues. They are having a hard time leaving their house and navigating to access these resources that Tony and Karen told us about. The second is that social groups, community groups, churches, friends, and family provide social support and have helped those who are aging and disabled access mental health care. So it's not just about social support, but it's about that community helping individuals to access the mental health care that they may need. The third is that nearly all individuals rely on some sort of community center or community group, something that meets regularly for social support. And then finally, the fifth is that systems of navigating mental health care need to be friendlier for older adults and individuals with disabilities to navigate. Also, I forgot the fourth one, which is equally as important, is housing as healthcare. So it's including mental health care too. So housing creates communities, and those communities are places of social support where neighbors check in on one another. So those are the 5 key findings from our focus groups. And to arrive at these recommendations that you can find at inlandaging.org, the needs assessment recommendations, we presented the findings to our advisory board, made up of community stakeholders and service providers. And from there, the board met and discerned 17 recommendations. Now that's a lot. And we'll discuss how we distilled those down further in a second. And so it was an exhaustive list if you want to check it out on the website. So this last spring and summer, we gathered together working groups and we had a working group, as Tony and Karen know, and led that focused on behavioral health and social support. And we met to narrow down these 17 recommendations, specifically focusing on the ideas of feasibility and sustainability. So which of these recommendations are actually feasible and sustainable to carry forward for our master plan for aging? And so the group came up with 4 strategic areas, focusing on several key objectives. And Tony and Karen are going to tell us a little bit more about those objectives. So within that context, will you share with us about what you're most excited about and also integrate some of the discussions about the objectives? We can start with Tony.
Thank you, Elizabeth. Yes, there's a lot that I'm excited about, and I only have a very short time to explain it, so I will try to keep it somewhat reframed. But our older adults and adults with disabilities and caregivers as well are aware of available services and how to access them. That's the most important thing. We have community resources. We'd love to see more, and we have best practices within our own systems of care and our partnering agencies as well that we can expand upon over the next years. But the first step is getting older adults and adults with disabilities and their caregivers the care that they need, right? It's building the awareness among individuals. It's families, caregivers, service providers, other resources that currently exist. So that's really, really important. And then secondly, we need to do what we can to ensure that older adults and adults with disabilities from all communities feel comfortable seeking behavioral health services to kind of break that stigma down, right? And make it more not only accessible, but also make it a lot more understanding that the community is behind them It's not just them going out on a plank, so to speak. Through intentional partnerships such as elected officials and community leaders, especially those who have experience to share, that lived experience is extremely important. And also tailored messaging that we can promote those resources, also known as town meetings or town halls, through media outreaches and hosting social events. So those are all great options or avenues that we can explore. In addition to that, social events can have the dual benefit of sharing resources as well as mitigating excuse me, loneliness. And as Dr. Sadewater mentioned, loneliness is probably one of the biggest aspects that older adults and adults with disabilities face, correct? It leads them down a path in which we certainly want them to avoid. So improving the overall behavioral health message and increasing social support can be done by formally systems as well as through partnerships and programs, but also through the development of the informal networks, support groups at a church, at a social group, community centers. All of those are key ingredients to social well-being that came up time in and time out throughout our work groups and our discussions. And it's a very valuable, right? Also, we recognize, and as far as value goes, is the value of intergenerational engagement. To support the achievements of this objective, we propose the formation of an intergenerational task force of all ages that engage sectors outside of behavioral health that can support the development of the intergenerational opportunities and support systems.
Nice, thank you. And Karen, do you want to tell us a little about the next two strategies?
Yes, definitely. So one that I'm very excited about is the behavioral health service quality access and navigation. The reason why it really aligns with what AgeWise does. AgeWise is an FSP wraparound service for individuals who are 59 and over who have severe mental health. However, one component to that is we don't have a wrong door. We do whatever it takes to help whomever we get a referral from. So, just for numbers wise, we've received 377 referrals just last year alone and only opened 97. But of the rest, we linked them. If that was linking them to a primary physician that they really needed to meet, or maybe linking them through their insurance, their primary insurance, or maybe they needed to hire another level of care, we linked them to housing. And so that accessibility and being that hub for them, I felt really aligns with this strategy. Um, with the FSP, we have occupational therapists, we have mental health specialists, therapists, um, peer and family advocates, and we do field based. One of the uniqueness of San Bernardino County is that we have a large landmass. And so, because of that, we have the mountains, the deserts, cities, remote areas. And so, when we are trying to think of how to service all those different populations with different cultures and different norms, we have to be creative in how we do that. And so, I'm really excited that this strategy is going to bring awareness through 211, IE Connect, and the Aging and Disability Resource Connection, which the Aging and Disability Resource Connection is a hub of resources. It's a website that individuals can go to, and it's supposed to really link you to the resources you need. But ultimately, their goal is to minimize confusion, enhance your individual choice by giving you all your options, and supporting your decision. And so when you have this resource plus Rolling Start, Independent Living Center, the Department of Mental Health, if we all work together, which we do, um, getting information out and having it be accessible for everyone is going to go a long way. Ignorance isn't the best when it comes to this, and that being able to get to it easy and minimizing confusion is key. Because as you know, people get very frustrated easily, or they get frustrated and then they don't try anymore. So they'll try for a therapist and don't reach a therapist and won't try again for who knows how long. So when we make it easy for them to obtain these resources, it will decrease their inability to get those services. So I'm really excited that we are bringing awareness to these different organizations so that people can get the services that they need and have access to resources that they probably didn't know existed before us doing a live stream or having this master plan or someone talking about it in their walking past or something like that. So I'm really excited for that strategy.
Nice. Both you and Tony brought up the fact that Riverside and San Bernardino are huge counties. They're very big and very diverse geographically. And you both gave some information on accessing resources for behavioral health and social support in different areas throughout the county. Tony, you mentioned your locations that you have supports in Blythe. And Karen, you mentioned your mobile locations. And so I want to encourage anybody who's watching who needs those supports to check out those different ways to access behavioral health and social support in the more difficult to reach locations of the counties. So thank you, Tony and Karen, for sharing about behavioral health and social support resources in the Inland Empire. And thank you all for tuning in to learn more about the Inland Empire Master Plan for Aging. Stay tuned for next month's discussion, where we're going to be continuing the discussion that we had at our recent conference this fall on the Master Plan for Aging and Equity and how those topics intersect with each other. So thank you both.
Thank you for having me.
Absolutely. Thank you both, ladies. I appreciate the discussion.
Absolutely.